individuality of the individual and in terms of their personal health tendencies or disease tendencies is something that has been foundational in the systems of ancient medicine, Ayurveda, Chinese medicine. And what's kind of interesting is that in many ways science is catching up from another angle. Not necessarily accepted by the insurance companies or pharmaceutical industries per se, but there's a lot of amazing tests these days that can really hone in on the individuality of the person, including genetic tests, which indicate many different tendencies that are there. And remember, these genetic tests don't really say that something will happen, but it can identify different tendencies. Stool tests, hair analysis tests, saliva tests, so many things are there to help identify these things. Now, the great healers of the past, Ayurvedic masters, Chinese medicine masters, could identify these things from a very different perspective and a different angle. But it was still all about really identifying the individuality of that person and their tendencies and then what's going on. So there's no problem using science in combination with these ancient healing modalities and principles. And in one sense, that's the wave of the future in terms of health goes. So that's the Veda way for today. Know that there's lots of things out there, but I have seen many practitioners in one sense becoming overly dependent on testing and missing some very fundamental things just by listening to their patients, really getting to know them and their situations, their stressors in body, mind, and spirit. So a good combination of both is, I think, in my opinion, really essential. So that's the Veda way for today. There's lots of great stuff happening, and there's lots of challenges about how we use that information. Okay, have a great day.